Good morning, PhD Annual Conference Committee. My name is Latifah Jehloh. Today, I would like to present the manuscript. The title is Transitional Care Interventions on Emergency Department Visits for Older Adults, a systematic review. Why this study is interesting? ED visits in older adults are often caused by preventable illnesses and can be prevented by providing effective transitional care intervention. Yet, the most effective transitional care interventions among older adults remain unclear. Therefore, this study try to identify and synthesize characteristics of both pre- and post-discharge elements on the effects of transitional care interventions on ED visits in older patients. The method. Inclusion criteria were 8. Over 60 transitional care interventions between hospital and home were described and assessed ED visits as outcome. Multiple databases were searched from January 2011 to August 2021. 2 others independently screened and selected study assessed by extracted data into a standardized form. There are 4 steps of systematic review. First one is formulate a question, develop protocol, conduct search, select study, and assess study quality, extract data, and analyze, summarize, and synthesize relevant study. The last step is interpret result. The step 1, formulate a question. This study used the PICO model. Population is older adult. Intervention is transitional care interventions. Comparison is both pre-post intervention and also intervention group and control group. Outcome is emergency department visit. Second step is develop protocol. That is included inclusion, exclusion criteria, searching strategy, study selection criteria and process, data extraction process, assessment of study quality process. The last one is data synthesis method. The inclusion criteria and exclusion criteria. All studies conducted in older adult patients discharged from a general medical ward or emergency department were included. Interventions targeted in the transitional phase between hospital were examined and measured the impact of the intervention on ED visits. The interventions had to include both pre- and post-discharge components by either provider or patient management, and ED visit was mainly measured. Studies had to be a randomized control trial, quasi-experimental design, retrospective study, cohort study, and case control study. Study were excluded if the target population was aged under 60 years and ED visit was not measured as an outcome. Data sources. To identify eligible studies, the study searched the following bibliographic databases: PubMed, the Cochrane Library, Signal, Web of Science, Progress, and the JAMA Network. Searching strategy. The searches were limited by only including studies published in English. The bibliographic search researches were conducted on 15 July until 6 August 2021, and the searches were regularly updated until 6 August 2021. Searching terms that have been applied to such article were transitional care or transition of care or care transition or discharge planning and intervention or program or strategy, and emergency department visit or emergency room visit or emergency department utilization or emergency room utilization or emergency department attendance or emergency room attendance, and older adults or elderly or geriatric or aging or seniors or other people or age 60 or age 60 plus. Study selection criteria and process. First, titles were screened for their potential relevance according to the population and outcome by the first order. Second, two others independently screened title and abstract for intervention eligibility. Third, an assessment of the full text was performed by two others independently. In case of disagreement, a third of others who chosen a priori was consulted. Data extraction process. The Cochrane data extraction from modified to fit the present patient group and intervention type. Data from the included study were extracted by two researchers independently. Extracted data included study characteristic and result, namely order, year of publication, country, study design, setting, participant, study design, outcome, follow-up time, and impact of intervention in numbers and or percent. Only data on the outcome ED visit were extracted and analyzed. Assessment of study quality process. The methodological quality was graded by two reviewers independently. The risk of bias criteria for Cochrane effective practice and organization of care EPOC review 2017 were used to evaluate the studies. To review essay study including allocation sequence generation, concealment of allocation, similar baseline outcome measurement, similar baseline characteristic, incomplete outcome data, participant blinding, outcome assessor blinding, contamination protection, selective outcome reporting, and other potential sources of bias in study. Discussion or consultation with a third researcher were used to validate and determine whether the requirements were met. Reviewer rated each study for risk of bias as low if all criteria were rated as low risk, moderate if one or two criteria were rated as unclear or high risk, and high if more than two criteria were rated as unclear or high risk as proposed by Davy. This is the dummy table of data synthesis method. The step 3, conduct search. The example of PubMed, Cochrane Library, Signal, Web of Science, Progress, JAMA. Step 4, select study and set study quality. This study used the prima flow diagram of selection of eligible papers. The last step is include the full text article, include the 13 study. Step 5, extract data and analyze, summarize, and synthesize relevant study. This is an example of study characteristic. The next will be the component of the transitional care intervention, that is included pre-discharge intervention as well as post-discharge interventions. This is the table of the effective transitional intervention. The next will be the risk of bias in included studies. Okay, the last step is interpret result. The result of study is 13 included study. 6, around 46.1% were randomized control trials. 4 study 30.8% were non-responders trial, and only 320 study. All studies were evaluated effects on ED visits, but in the different period of time, range from 1 month until 12 months after discharge, and with different baseline group, pre-post intervention and between group. All studies describe multi-component interventions in either pre or post-discharge phase. Transitional care strategies that have been shown to reduce ED visit in older adults include pre and post-discharge components, as well as high-intensity care delivered less than 6 months of discharge. The conclusion of this study: due to inter-study heterogeneity and poor methodological quality, determining the intervention's effectiveness in reducing ED visits by older people is hindered. There is a need for more evidence-based research with consistent and trustworthy effect assessment in the future. Okay, thank you.